Today is World Alzheimer's Day. This is done to create the awareness among the general public about this disease. Alzheimer's disease was described way back in 1903 by Alois Alzheimer to describe a condition which has been named after him. We all know what is dementia. Dementia is a progressive disease where there is an intellectual deterioration with loss of memory and other higher mental functions. Alzheimer's disease is one such dementia. So, Alzheimer's disease constitutes about 60% of all dementias. What does it happen? Why does it happen? Is the question every patient asks. It is a disease of aging. Most often it occurs above the age of 65. As you look at this slide, as the age advances, there is definite increase in the prevalence of the Alzheimer's disease. For example, at age of 65, we have about 5% of the people suffering from this disease. As age advances, gradually it goes up, and by the age of 80, it will be 40%. And if a person survives up to 100 years, there is almost 1 in 2 chance of developing Alzheimer's disease. What is this Alzheimer's disease? Why does it happen? It is due to shrinkage of the brain with a death of the nerve cells, resulting in loss of functions of the brain, which may be in the form of loss of memory. The memory is usually the immediate memory or the recent events are forgotten, but they can remember the old memories which are there 20 years ago or 30 years ago. It looks strange for a person to understand why the person is forgetting the recent event, however he can remember very old things. They may have problem in thinking, logical thinking, reasoning, they all go one by one, and then they have a difficulty in doing day-to-day activities, and this is a disease which is a progressive disorder. So, how common is this disease? That is a question everybody asks. You can look at this slide where it has been mentioned that the number of Alzheimer's disease as on today, it is around 4 million in this country, and this is estimated to go up to 6.4 million by about 2030, and that will double to 12.5 million by 2050. So, you can imagine how the disease will evolve over the years. Why does it happen? Because we are all growing old. The graying is occurring in this country. That means the older population is increasing. Maybe it is a good point that we are able to control many diseases, we are able to have a good nutrition, we are able to control infectious diseases, but that has led to the problem of aging. As the age advances, as I told, that this disease is also going up. In the world scenario, if you take the statistics, it says that there are about 60 million people suffering from Alzheimer's disease as on today. And to this, we add about 10 million every year. So, one can imagine how grave this disease would be as the years passes. So, what can be done? Is it possible to detect it early? Yes, one need to detect early so that the early diagnosis can be made. How can one make the diagnosis? The diagnosis is made by the doctor examining the patient when they come to us with an impairment of memory for the recent events. And that is the first symptom with which the patient comes to us. And as we go through the history, we come to know that the patient is forgetting the things which are very, very essential for his or her daily activities. Gradually, they will also develop no logical thinking, and they will also develop their problems in reasoning. Some people also develop some behavioral issues which may be in the form of aggression, or it may be form of depression, or they may become very hyperkinetic, hyperactive as the disease progresses. These are all the different types the Alzheimer's disease can present to us. What can be done? Alzheimer's disease is difficult to treat. There is no definitive cure. But can we do something for these patients? Yes, certainly we can do something about it. So I would like to point out here two important things on this day of Alzheimer's disease, that patients should come early. When you come early, we make the diagnosis early. Just today, I had a patient who had come with an advanced disease, wherein we cannot do much about it. So better you come to the doctor when we make early diagnosis. There are 4 A's we talk about. One is amnesia, which is nothing but impairment of memory. Then we have aphasia, where there is speech problem. Then when we have apraxia, where we have difficult to do certain things by the hand, though there is no weakness. For example, I may have difficulty in writing without having a weakness. And the last one is agnosia, where I cannot see though my vision is all right. So 4 A's are extremely important to make the diagnosis of the 5th A, which is nothing but Alzheimer's disease. So once we make the diagnosis of Alzheimer's disease, we confirm by doing an MRI scan, and after that we start the treatment, which can be divided into 2 things. One is pharmacological, that means we give the medication for that. Some medications are available, but more than the medication, what the family can do for Alzheimer's disease is extremely important. That is, family should support the patient, and the patient has to follow the instructions given by the family in the form of engaging them with interacting with them much more than usual. And they should be given some exercises like puzzle solving, or to remember the things, or to encourage them to play some games such as chess games, card games, or carom games, which involve certain thinking. So we always say use the brain or lose the brain. So when you want to utilize your brain, please use it properly and utilize to the maximum extent. And of course, the yoga in the form of pranayama and yoga nidra and certain other interactions with the patient will definitely help to prolong the memory and treat the patient along with the drugs. I was talking about the treatment of Alzheimer's disease. The question arises, can this be prevented? Yes, it can be prevented provided you follow certain of the things. They are defined as risk factors. Can you see this slide which shows there are 2 columns. One is modifiable risk factor, one is non-modifiable risk factor. There are non-modifiable risk factors like age. No one can reduce the age. Or there are certain genetic factors which we carry along with us. That cannot be removed. That is ApoE4. On the other hand, there are modifiable risk factors which includes blood pressure, diabetes, obesity, smoking, alcohol, lipid profile. All these are called cardiovascular risk factors. Same affects the brain, and hence if one wants to prevent the Alzheimer's disease, please take care of all these risk factors which are modifiable. That is very, very important to prevent the disease. This year's theme is never too early and never too late, which is a very important aspect. So when we suspect that there is possibility of cognitive impairment or memory impairment, please approach your doctor at the earliest, so that never too early or never too late. Remember the theme and follow the principles. So I have a last slide. You must watch this slide, because we say we remember the people who do not remember us.